Hello class, my name is Phoebe Odhiambo. I was born in Kenya. I came to the United Nations about 25 years ago. I am married with three boys, ages 30, 30 and 26. So I have a twin. I have a Bachelor's of Arts in Anthropology and Bachelor of Science in Nursing. I'm an RN. I am a clinical case manager at Nizoni Home Health Agency. In 1990, I worked for the United Nations Lifeline Sudan Health Programs as a program manager. In Sudan, I witnessed the atrocities war can bring to a community. At the same time, I witnessed how a well-coordinated public health programs can have on the same community. And I realized that an informed, health coordinated community leads to a healthy community. Note that there are no diseases, but it's a healthy, informed community. In the year 2000, I changed my career to nursing. I joined my local emergency health department and free health clinics here in Framingham, Mass, where I live. I have volunteered at Smoc, a local non-profit organization, as a nurse educator. I also started a free medical clinic in Kenya with the aim to help improve health, well-being, and reduce health inequalities, with a focus on primary health prevention. Kenya has one of the highest mother-child mortality rates. Thus, my interest in the efforts and effects of WIC program. My goal is to work in the international organizations, again, targeting this time mothers and children in public health programs. I'm going to talk on South Middlesex Opportunity Council, which in short is SMOC. It's in Framingham, Mass. According to SMOC 2017 yearly report, SMOC is a local health program in Framingham with a mission to improve the quality of life of low-income and disadvantaged individuals and families by advocating for their needs and rights, providing services, educating the community, building a community of support, participating in coalitions with other advocates, and searching for new resources and partnerships, with the focus on primary health prevention. The programs that they offer are family and women children, fuel assistance, low-income housing, child care, WIC, which is a program that I'm going to talk on, behavioral health counseling, rape counseling, addiction counseling. All these, if you look at them, they have primary prevention, health prevention, not just for an individual, but for a family. And the family makes a community. WIC, as I said, is a South Middlesex Opportunity Council program. So I will talk on this WIC program, a primary prevention program that serves women, infants, and children. That's why it gets its name, WIC. WIC program is a federal program created in the early 1970s to respond to concerns about poor nutrition among women and preschool children. Local nonprofit agencies, health centers, and hospitals administer the program across Massachusetts using both federal and state funds. This was very important to me because when I went to school long time ago, when I was in grade 4 and 5, my president then in Kenya started a program where children would get milk in the schools. And that would help the children so that even if we didn't get milk at home, there would be milk in school first thing when you go to school, and then there would be some lunch, which is something that I've seen in this country that has really impressed me. And this is why I still go for WIC. Now, the goal and the mission for WIC is keeping pregnant and breastfeeding women, new moms, and children under age 5 healthy. If we get them healthy at that time, then we've started the community, we've started the family on a good health note. WIC is a nutrition program that provides nutrition and health education, giving healthy foods and other services free of charge to low income Massachusetts families. WIC welcomes men. WIC recognizes the important role that fathers, grandparents, step parents, and other guardians play in caring for kids, which is very important because it's not every time that it's a mother who is taking care of the children. The children are taken care of by a community. There's a saying in my country that it takes a village to raise a child. So the next thing that I'm going to talk about is week focusing on primary health prevention, support groups, breastfeeding, immunization, healthy foods. Breastfeeding, with its many known health benefits for infants, children, and mothers, is a key strategy to improve public health. The American Academy of Pediatrics recommends that infants be exclusively breastfed for about first 6 months. In my country, it is something that is just normal. You have a child and you breastfeed. But here I found out that it is something that we have to educate mothers and we have to tell mothers how important it is in primary prevention. The 10 essential community health functions are to monitor health, diagnose and investigate, inform, educate, and empower people, mobilize community partnership, develop policies that are healthy to the community, enforce the laws that have already been set, link to provide care, assure competent workforce, evaluate, and research more on how we can help our community. I will talk on Smoc Wic's program focusing on three of these: informing, educating, and empowering the community, mobilizing community partnerships, evaluation of program effects. Are they achieving what they set up to achieve? Now let's talk about information, educate, and empower parents. Parents, if you empower parents, you empower the community, and with that, you are able to manage the health of the community. So to empower them, they empower these parents to make informed, healthy choices. They make referrals to medical and dental care, health insurance, child care, housing, fuel assistance, and other services that can benefit the whole family. And if you benefit each family, you're benefiting the community. How does WIC help to reaching global health through community partnerships? So let's see what they do. Immunization screening and referrals to primary care doctors, referrals for fuel assistance. The National WIC Association in 2017 launched in September 2014 National Implementation and Dissemination for Chronic Disease Prevention in Women, Infants, and Children. And we've seen a lot of chronic diseases in children, even at their smallest age. But if we start the prevention early, then we are going to have a healthy community. They also have partnered with CDC, Division of Community Health, funded the National WIC Association to build and strengthen community infrastructure to implement population-based strategies to improve communities' health. Also, WIC has partnered with John Hopkins who makes checks to WIC farmers, an initiative to local farmers stands to accept WIC fruits and vegetable checks. We know we have to eat fruits, we know we have to eat vegetables, and sometimes they are very expensive. But if we have people like John Hopkins stepping in and giving these checks, it's very important in keeping people healthy. Now, this is they're still mobilizing. Let's see what they are mobilizing. The National WIC Association partnered with American League of Obstetricians and Gynecologists and 32 local WIC agencies to reduce and prevent chronic diseases by improving access to healthy food environments and improving access to prevention and disease management services. Also, WIC has partnered with the local government to provide housing assistance to low-income families. Also, they've partnered with the local supermarkets to accept WIC vouchers and stamps in purchasing healthy foods. So you can only buy certain foods. You just can't go and start buying any other foods that you want, alcohol, what with their vouchers. No, they are only accepted for certain types of foods that are healthy and gear to bring our community to a healthy stand. Now, how does WIC evaluate their programs? Remember that mothers, or not only mothers, but the parents bring their children every month so that they can pick their vouchers. So at these meetings, how do they evaluate? How do they talk to these people to make sure these parents, and how do they see the children and evaluate the children to see if their programs are working? Now they check the iron levels in the children. So if we are able to check the iron levels in our children, we are already preventing a lot of diseases that are associated with iron deficiency. They also check the national preference um, and effects. Nutritional preference and effects. Nutrition. What do you buy? When you come and you're talking to a mother, tell me, what do you buy? What type of foods does the baby like? Well, how do you get it? Are you able to get it? Do you go to the farmer's market, or do you go to, which stores do you go to? From there, you can see what are the nutritional preference that the family is making. And you can ask the child, which type of foods do you like? Which type of foods does mommy or daddy put on the table? And from there, you are able to know and register what kind of foods these children have. They have the growth chart. Every time that the child comes, there's a growth chart. Is this child growing at the rate that they should be going? Is this child healthy? What is the weight of this child? Is it growing? So even as the pediatricians are checking these children, they are also monitoring to see if the program, the community program, is working. Breastfeeding compliance. Are you breastfeeding the baby? Are you having a problem with with breastfeeding? Is everything working well for you? What else is the child eating? Is the child drinking substitute milk? Or how many times are you breastfeeding? It is They're getting all the information from first and from the primary person, from the mothers, from the children, and from there they are able to evaluate their programs on monthly basis. What about housing availability for low-income families? If the children are on the streets, then all the diseases that we've been talking about, all the things that we want to prevent, they are coming at our doors. But if everybody has a place to live, very important. Vaccination compliance. Every time that parents bring their children, they check their vaccination compliance. Did they go for vaccination? Are they in compliance? When is your next vaccination? And all these are leading to a healthy community. So the goal for WIC is primary health prevention and keeping and maintaining a healthy community. Thank you. Here we have all the references that I got. Please You're welcome to look at them, and you're welcome to call me or email me with any questions. Have a nice evening.